You should not take Abilify if you are allergic to aripiprazole. Abilify may increase the risk of death in older adults with dementia-related psychosis and is not approved for this use. To make sure Abilify is safe for you, tell your doctor if you have heart problems or stroke, high or low blood pressure, diabetes, convulsions, low Abilify, how to use and use it most effectively. Point 1. What is Abilify? Abilify is an antipsychotic drug. It works by changing the activity of chemicals in the brain. Abilify is used to treat symptoms of mental disorders including schizophrenia in adults and children who are at least 13 years old. Abilify is also used alone or with a mood stabilizer to treat bipolar I disorder, manic depression, in adults and children who are at least 10 years old. Abilify is used together with an antidepressant to treat major depressive disorder in adults. Abilify is also used in children at least 6 years of age to treat Tourette's disorder and to treat symptoms associated with autism spectrum disorder, irritability, aggression, mood swings, temper, and self-injury. 2. How to use the drug Abilify. Remember, only take the Abilify orally disintegrating tablet from the pack when you are ready to take it. Put the tablet in your mouth and let it dissolve without chewing. Swallow several times as the tablet dissolves. You can drink water to help swallow the dissolved tablet. Patients need to use Abilify exactly as prescribed by the doctor. Abilify can be taken with or without food. Store Abilify at room temperature away from moisture and heat. Abilify liquid can be used for up to 6 months after opening, but not past the expiration date on the label. Your doctor will need to check your medication use on a regular basis. If you also take an antidepressant, don't stop taking it suddenly, or you could have unpleasant symptoms. You need to consult your doctor before stopping Abilify. The dose of Abilify drug should be followed as prescribed by the doctor. The recommended dose in some cases is as follows. Schizophrenia. Use 10 mg to 15 mg of the drug per day without meals. Bipolar I disorder, 10 mg to 15 mg daily, possibly supplemented with lithium or valproate. Depressive disorders, use a dose of 2 mg to 5 mg drug per day. Abilify overdose symptoms may include drowsiness, vomiting, aggression, confusion, tremors, fast or slow heartbeat, seizure, convulsions, weak or shallow breathing, fainting, or kissing passionate about. If you forget a dose of Abilify, take it as soon as possible. But if it is almost time for your next dose, skip the missed dose, take your next dose as usual. Do not take 2 doses at the same time. While using Abilify, you need to avoid getting up too quickly from a sitting or lying position, otherwise you may experience dizziness. In addition, you also need to avoid driving or dangerous activities until you are able to do so. Dizziness or drowsiness can lead to a fall, accident, or serious injury. Avoid alcohol. Dangerous side effects can occur when you drink alcohol. 3. Some notes when using Abilify drug. You should not take Abilify if you are allergic to aripiprazole. Abilify may increase the risk of death in older adults with dementia-related psychosis and is not approved for this use. To make sure Abilify is safe for you, tell your doctor if you have heart problems or stroke, high or low blood pressure, diabetes, convulsions, low white blood cell count, WBC. Aripiprazole can cause high blood sugar, hyperglycemia. If you have diabetes, check your blood sugar carefully. The oral disintegrating tablet form of Abilify may contain more than 3 mg of phenylalanine per tablet. Before taking Abilify disc melt, tell your doctor if you have phenylketonuria, PKU. Using antipsychotics during the last 3 months of pregnancy can cause serious problems in the newborn baby. Tell your doctor right away if you become pregnant. Do not stop taking the medicine without your doctor's advice. If you are pregnant, you will need to be monitored for the effects of aripiprazole on your baby. Also, consult your doctor to see if it is safe to breastfeed while using Abilify. 4. Side effects of the drug Abilify. Get emergency medical help if you have signs of an allergic reaction to Abilify such as hives, difficult breathing, swelling of your face, lips, tongue, or throat. Tell your doctor right away if you have new or sudden changes in mood or behavior such as depression or anxiety, panic attacks, trouble sleeping, or if you feel impulsive or irritable. Angry, agitated, hostile, aggressive, restless, more active or talkative, or having thoughts about suicide or hurting yourself. If you have the following symptoms, tell your doctor right away: severe agitation, distress or restless feeling, twitching or uncontrolled movements of your eyes, lips, tongue, face, arms, or legs. Unusual facial expressions, difficulty swallowing, problems with voice. Convulsions, muscle cramps, high fever, sweating, fast or irregular heartbeat, tremors, confusion, feeling like you might pass out. Low blood cell count, fever, chills, sore throat, attenuate, easy bruising, unusual bleeding. High blood sugar with symptoms of increased thirst, increased urination, dry mouth, and fruity breath. You may experience increased sex drive, abnormal desire to gamble, or other intense desires while taking Abilify. If this happens, you need to talk to your doctor. Common side effects of Abilify may include blurred eyes, increased salivation or drooling, muscle stiffness, uncontrollable muscle movements, shaking, anxiety, feeling restless, weight gain, nausea, vomiting, constipation, increase or decrease appetite, headache, dizziness, drowsiness, feeling tired, sleep problems, insomnia, cold symptoms such as sneezing, stuffy nose, sore throat. This is not a complete list of Abilify side effects and other possible side effects. Contact your doctor for medical advice about the side effects of Abilify. Abilify is a prescription medication used by doctors to treat a number of mental illnesses. To ensure the effectiveness of treatment and avoid side effects, users need to strictly follow the instructions of the doctor. Any drug, whether used to treat disease or support health, has its own principles of use. If you do not understand the basic principles when using drugs, patients may misuse them and bring harm to them. Unwanted effects. Please consult your doctor before using medicine. Please click subscribe and press the notification bell to support me. Thank you.